Good afternoon. As you know, we remained locked in a fight against coronavirus. The pandemic has occupied our lives for many months, and we are now grappling with the emergence of a new and more infectious strain.
As far as we can see, it doesn't make it hidden from the immune system. So if you've had an infection before, actually the evidence is that you probably neutralise this virus as well.
We are therefore asking you to stay at home.
The need for zealous enforcement has been remarkably low because we are a country that is governed by consent and people have complied with the restrictions by their own consent.
To protect the NHS and save lives while we work hard to roll out the vaccine as quickly as possible.
Their problem is they won't want to produce those vaccines unless you can show you've got a plan that if they produce them, you can use them.
As of today, 2,431,648 people have been vaccinated across the United Kingdom.
They do not prevent you from getting the infection, and they do not prevent you from passing on the infections.
Today, 45,533 people have tested positive for coronavirus.
The public keeps hearing that the number of COVID cases continues to rise and is out of control.
Well, you have to differentiate COVID cases, which are people that have positive PCR tests. And those could be completely healthy people without any symptoms. And a majority of them are like that. Those would be determined to be cases. Now, normally in medicine, a case is someone who's actually sick. Now, these aren't sick people.
As of the 10th of January, 35,075 people are currently in hospital with coronavirus. That is an increase of 22% from this time last week.
Notice the zoom for the drama.
And sadly, of those who have tested positive for coronavirus across all settings, 83,203 people have died.
Across all settings. So does that mean anything from falling out of bed, breaking your leg, falling off a ladder, getting run over, anything untoward, and you're instantly labelled as, oh, you've got COVID, because we suspect you've got it. So if you cark it, well, you get labelled with it, and you can get tested. So all settings doesn't mean jack shit, really.
1,243 fatalities were reported yesterday.
And fatalities includes anything from being run over to gang violence to being stabbed. You name it, that's included in fatalities. That's the total number. Don't forget that. Total number of fatalities, which includes all of those things.
My thoughts and prayers are with the families of those who have lost their loved ones to coronavirus. These numbers are horrifying, and they underline why it is absolutely critical that everyone plays their part and follows the rules. We know that most of the public are doing exactly that.
Some people are doing it because they don't actually know any better. They just follow stuff because they just don't think for themselves. So they're easily led. And they don't like it when you think for yourself. So they persecute you with fines and things for doing normal things.
They are doing the right thing and they are staying at home. And I want to say thank you to the millions of people who are putting our country's collective health first. To everyone who has put off seeing their parents, grandparents, their loved ones, their vulnerable loved ones, thank you. You have helped to stop the spread of the virus and save lives.
So there's no way you can contain that by wearing a mask or social distancing.
Our ability to get through the coming weeks and months depends on each and every one of us contributing to what is truly a national effort. But a minority of people are putting the health of the nation at risk.
And it's important to recognise it's not to stop everybody getting it. You can't do that. It's not possible to stop everybody getting it. And it's also actually not desirable because you want some immunity in the population.
By not following the rules.
What the
That is why the Secretary of State
Welcome again to Muppet Labs, where the future is being made today.
for local government has today talked to councils about the role that they have to play in enforcing the rules and in saving lives.
So now instead of your council working for you, they're now working for the government. Funny that, isn't it? You pay your council to work for you, you tell them what should be being done, but government's now telling them otherwise. Interesting, I bet.
And our police officers are now moving more quickly to issuing the fines where people are clearly breaching coronavirus regulations.
So we're more quickly going to see about defunding the terrorists, which is you, you're the terrorist.
Nearly 45,000 fixed penalty notices have been issued across the United Kingdom. So my message today to anyone refusing to do the right thing is simple. If you do not play your part, our selfless police officers...
Selfless police force. Selfless police officers. Well, there are no police... Well, there's only a few police officers because they actually have a rank, which makes them an officer. All the rest are constables, but they parade themselves around as though they've got some form of greater authority by saying they're a police officer. They're not, they're police constables. It's in legislation. It's spelt out in black and white. Go and read it. Any of these constables try telling you that they're a police officer is trying to enforce more authority over you to tell you bullshit. And they don't like you knowing it, because you can put them on notice. They could be looking at a 14 grand fine for impersonating a ranked police officer who is ranked. They're not ranked. They have no more greater authority than you making a citizen's arrest. Interesting, isn't it?
Who are out there risking their own lives every day to keep us safe. They will enforce the regulations.
Are you a business? Are you a business? Regulations don't apply to you. Regulations apply more to corporations, to organisations, to businesses, to everything else that you're not. You're not regulated. Nobody monitors you whatsoever. You're a free person in this country. If you don't understand these things, they're going to take the piss with it.
And I will back them to do so, to protect our NHS and to save lives. Our police officers are not immune from the virus.
They're not immune to it. They come into contact with more people than anybody else over it, yet they're not falling down in the droves. Bit odd that, isn't it? So they could actually be one of the biggest spreaders of this virus. Bet they haven't thought of that, haven't they?
Far too often they're having to risk their own lives and their own health by coming into close contact with people, including those who deny the very existence of coronavirus.
Now, seeing as how there only seems to be, what I think they said, the main sample they've gone off actually contains monkey RNA. They haven't actually tested this virus out using Koch's postulates, which is where they test it from infecting one subject with another one and ensuring that the same virus is reproduced and the same effects and the same symptoms carry on. We've got a bit of a problem because this PCR test could be just picking up any old crap because there's no real actual evidentiary proof. And seeing as how the CDC doesn't hold this virus on record means they're not actually sharing anything internationally, but they keep telling you they're sharing information internationally. Well, who else has got it then? Because nobody else has. Nobody else has got a copy of it. Nobody else has it. Nobody else has isolated it. Nobody else has it on record. Interesting? I call it bullshit.
To keep us all safe. The police and fire service staff throughout this pandemic have been on the front line, helping their local communities. They are the very best of us all, and I know that the public share my gratitude for their incredible contribution.
Nobody's taking away anything from what these people do under normal circumstances. The problem is, They are now being abused by the system that they actually work under. And they don't understand it, and people don't realise it, that they're actually being manipulated and abused by the very system that's in place that is meant to protect you, which is the British Constitution and the legislation. Under those two things, this government and a select bunch of people throughout the whole of industry and the government are manipulating things to fuck this country over. Seriously. This little bitch is one of them. The point scoring system for immigration, why does everybody have to get used to it? I'm not an immigrant. Why should I need to get used to it?
They're also there to help the most in need, including anyone experienced or at risk of domestic abuse. You can leave your home to escape harm and seek refuge, and anyone who is in immediate danger should always call 999. We are now at a critical stage in our battle against this virus. To protect those that you care about and the capacity of our hospitals to protect us all, please stay at home to protect the NHS and save lives.
And given the effects of restrictions, it was obvious that actually you need to do more in order to retain it. If you need to do more in order to retain it, if you need to do more in order to retain it, if you've got a higher degree of transmissibility. So I think the view from SAGE and the papers are there was that it was likely that more measures would be needed to retain transmission of a variant that had an intrinsically higher transmissibility rate.
Does that make sense to you? They want to retain a strain of variant that has a high transmissibility rate. So why would they want to retain it? And who's retaining it? Oh, that's right, it's in you. You have this high transmissibility rate strain of virus. They want to retain it in you. Funny that, isn't it? Is that because something he even explains how it works?
You don't just make one antibody against one bit. You make lots of antibodies against lots of different bits.
They don't want it happening because you'd end up building immunity to it and you'd pass your immunity on with herd immunity. And that's why they want you all stuck at home on your own. To keep it going, prolong it, retain it.
And that's indeed what's now borne out, that you see very fast growth, very fast spread amongst all age groups, and it's going to need really much firmer measures in order to keep on top of this.
Thank you.
Guinea pigs.
They had what's called an anaphylactoid reaction, which symptoms could be
Guinea pigs.